Hi, my name is Bronte and I'm a public health and nursing student from QUT. From July to September of 2018, I undertook public health placement at the Southern Queensland Centre of Excellence in Aboriginal and Torres Strait Islander primary healthcare. It was overall a great learning experience that vastly improved my knowledge and understanding of cultural safety, as well as public health practice, specifically in project planning and preparing health messages for a specific target audience. The facility consists of a 2-level clinic that includes a pediatric and a specialist space, with various specialists visiting on days throughout the month, a gym, a multi-purpose room, and a large office space where I was. During my first week, I participated in NAIDOC Day's preparation. NAIDOC Week is a celebration of the history, culture, and achievements of Aboriginal and Torres Strait Islander peoples. Another student and I packed a total of 350 goodie bags filled with lots of health promotion materials and other fun things that were given away at Inala's local NAIDOC Day. NAIDOC Day was an awesome experience to learn and celebrate Aboriginal and Torres Strait Islander culture, as well as interact with the community. The day consisted of assisting in running the health promotion activities in the Centre of Excellence's tent, as well as enjoying performances of Indigenous art, song and dance. This was a great introduction to the placement as I got to build up relationships with the staff and work up my communication skills in this professional environment. I also attended Musgrave Park NAIDOC Day. This time I was working with the immunisation nurse, assisting her with administering free flu vaccines. I was also commissioned to develop this poster that was displayed on the day to promote the free flu shots. It was pretty difficult to reel people in. Making the flu shots sound appealing was a tough task, and we got a lot of strange looks, but we ended up giving around 50 for the day. During my first week, I also attended an immunisation update session to inform immunisation nurses of the schedule changes in vaccines. This was an interesting experience to learn how vaccines are recorded, when they should be given, and the statistics behind how they actually prevent diseases. The following week, the other students and I were assigned a health promotion project. The NUM of the clinic wanted to improve the health promotion in the clinic area. He wanted us to develop a health promotion calendar of sorts where we would promote a different health topic each month within the clinic, with the target audience being the patients of the clinic. We were to conduct our own research and consult various members of the clinic to discuss ideas. We conducted weekly meetings with the group and our supervisors to ensure we stayed on track. We started off quite ambitious with our topic choices, but after a few weeks of not getting it far as a group and receiving advice from our supervisors, we decided to focus on one single topic, kidney health, only because that's what we had collected the most resources on. Implementing what we had learned at uni about planning projects to a real-life situation was a lot harder than I thought. There are so many factors that we had to ensure we fit in with. We had issues of staffing, funding, timing, and developing a health message that was worthwhile. There was a lot of back and forth with ideas. With the time we had, we struggled to come up with enough creative health messages that would engage the clinic community. We had to do some in-depth analysing as a team and ensure we were upholding cultural safety as well as using the right language and imagery. We also had to upkeep our communication with the clinic staff, as they would be the ones implementing the project. We had to make things easier for them as they already had their job to do. Being exposed to this type of work and work environment has been a great opportunity for me to learn and advance my professional development. The facility was great, and I've learned so much more about cultural safety and the determinants of health in Aboriginal and Torres Strait Islander community of Inala. It has been a great opportunity to work with such a diverse team of professionals. Everyone has their own area of expertise, and it has been great speaking to others. Everyone was so lovely and willing to share their wealth of knowledge. Working on the project itself has been a frustrating experience for me, however. I have learned a great deal of new appreciation for programs and project planning, and the extensive process of developing health and health promotion messages and having them delivered to the target audience in a way that is effective and engaging. It has also exposed me to a very in-depth analytical thought process, as well as patience, where there was a lot of going back and forth on different ideas and actively practicing communication skills. I have also learned that the office life is not for me. I enjoy being more active while I work. However, I believe I will use the skills I have gained on this placement throughout my career, even as a nurse.